Okay, so I'll tell you first we need to understand that as we eat food, we need variety of foods to have a balanced diet. You just can't eating dal or sambar only one thing, or just chapati or just rice. You need mix of things in your plate to give you a proper nutritional nutrition to your body and proper balanced diet. Similarly, exercise are of three kinds which everybody needs to inculcate. The cardiovascular exercise, which means walking, running, cycling, jogging, swimming, anything which increases your heartbeat. And this should be at least 30 minutes every day for at least 5 days a week. This is the minimum prescription. Second is your stretching. So stretching is like, movement of your joints, all the joints as we do it in yoga or stretching exercise, which has to be done every day and which can be done even during office hours where you are sitting. Every 1 hour, you move one of the joints to and fro. So clockwise, anti-clockwise, the way they are supposed to move, twists and turns. These can be done even during office time without putting extra efforts, but in 10 minutes, you can just stretch yourself. And third is your strength training, which should be done at least twice a week. That means strength training means picking up the external weights or using your own body weights to strengthen your chest muscles, the major muscles, the shoulders, the biceps, the thigh muscles. And this is the way normally prescribed. So you have a well balanced of all kind of exercises for yourself. And indulging too much, so I would suggest 1 hour every day is enough for a normal non-athletic, somebody who's not planning like not wanting to go in a bodybuilding show. I think this is enough to keep yourself fit. But when we say exercise, it should not be at the expense of sleep. And I'll tell you the question which you have asked, that why people have developed heart attack despite exercising. I have gone into those case studies. I have a lot of case studies where people who were considered as exercise freak, diet freak, have died of heart attacks. And when I have dwelled into their lifestyles and tried to find out why did they develop a heart disease, I have found two things: either they were sleeping less, or they have been under tremendous stress. So when you are not sleeping well, or you are under tremendous stress, there is an inflammatory reaction in the body. And even the minor blockages means severe blockages are one which are more than 70%, which will actually cause symptoms of angina, heaviness of chest and walking, and they come into attention much early. But if a block is 50%, 60%, less than 70%, they do not produce symptoms. But because of the inflammatory activity, they can get ruptured and cause a heart attack. What happens when you get a cut on the skin? The blood oozes out and forms the clot. Similarly, the blockages inside the arteries can get ruptured if they are thin, and they can cause clot formation and cause a complete occlusion of the artery and cause a heart attack. And this is what happens in those healthy gym going people who have been exercising, but they are under tremendous inflammation because of the inadequate sleep and a lot of stress.